Rochelle Monte, what would you like to say to the boss of Allied Health for whom you work that you think would really make a difference to the work you try to do?
I don't blame any one particular company. The companies do the best they can with what they're given. The truth is it goes straight to the top. Unless the government actually acknowledge the importance of the home care sector within this country, people are going to continue to be failed and let down by a service that's there to protect them.
Dr Preece, that's a fair point, isn't it? Isn't the government, in fact, making life absolutely impossible for your company, in fact, to deliver a decent service?
It is difficult in these financial times we find ourselves to do all the things we want to do. What I think is for sure is that the physical needs of our patients are for the most part being met. There may be exceptions to that. We do 21 million visits to people who are in their own home every year. But where I think that there remains an issue is the emotional needs, the wider well-being of patients. We might be there in the morning to get people up in the morning. We might be there at night to put them at bed.
You might be there for 15 minutes.
We might be there for a short period of time in some cases, that's true. But that means that the patient is often on their own for a long period of time. So it is really important that we think about wider issues like social isolation and the involvement of communities improving that.
Rochelle, Dr Preece is saying, well, the physical needs are being met. Maybe the emotional ones are not. What would you say to that?
Definitely, a lot of people are being failed and let down by the system, in particular with relation to the huge turnover of staff caused by the poor terms and conditions of employment in the sector. People haven't got the continuity, they haven't got regular care. And it's difficult. It's a difficult situation to complain about when you're receiving home care services. I've worked for many providers and I've found that actually the situation's the same right across the board. And that's why I would urge the government to look at the importance of home care services. You're working one-to-one with people unsupervised, yet because of the demands on the system, people are being employed with little or no experience to cope with the increase in demand, and that in itself puts people at risk of neglect and abuse.
That's a very
and I don't want people to be failed by a system I love.
That's a very interesting answer, because in a sense what you're saying is you can't divorce physical needs and physical provision from emotional needs and emotional provision, that in fact, if you don't know the person coming in, if they're different every day, then you're going to find it emotionally very challenging because they're doing very intimate things to you. Is that right?
Intimate personal care tasks that a lot of people can't live without, and you need to have trust in the individual who's providing that care.
Right, and let me just pick that up with Dr Preece, because this is it, isn't it? You can't really subject elderly people to a constant different change every day of different people coming in to tend to them. If they're having intimate treatment, I mean, having their toilet and all the rest of it done, then the thought that it's somebody different every single day is an emotional trial. It
is, and where I think I'd absolutely agree with what Rochelle's been saying, what we saw in that film, is this important sense of vocation that care workers have. If we want to provide the best care, we have to attract and retain the best care workers.
But
and that means thinking...
Zero-hours contracts, which litter the industry, is no way to retain good staff. It's no way to retain consistency.
We are looking in allied healthcare right across the way we reward people so that it's much clearer for everybody in future.
Well, you may be looking at it, but at the moment, as we speak, this thing is a disaster.
Well, the zero-hours contract, at the moment, the average amount of hours that any of our care workers do is about 25 hours a week, and we roster our work usually 2 weeks in advance.
But so why did you ever get into 0 hours? Surely the one thing you would say about healthcare, you would say, right, we're going to run a company which is going to reward people enough to ensure that they go on working for us and give us the top service. Zero
hours has been the norm in this sector for all time. And that's why we're looking very closely at it, because it may well be that that needs to change in the future.
But Saga has a reputation for brilliant holidays for old people. What on earth is it doing providing substandard care to the people who most really love the service they used to give?
To be clear, we are a sister company of Saga. We are not
a sister company. You have the same directors.
But what we
exactly the same directors. And Saga bought Allied Healthcare bought it.
What we're absolutely clear about is that the heart of this is giving really great care to our patients. That means that we've got to identify and recruit and retain the best care workers, and that is absolutely on our agenda. There are things in that film that I don't recognise as features of Allied Healthcare. But what I do recognise is that we have fantastic care workers delivering fantastic care, and we need to look at every way that we can support them in the future.
So you're a bit of a minority, it seems, Rochelle. They were delivering fantastic care to a very large number of people.
Can I just say that I think it is unfair to lay the blame of this whole situation on Saga or Allied. It is across the board. These problems are deep-rooted within the system, and it's the system that needs to change. The whole system of 0 hours has come because of the commissioning process of the local authorities who only pay for contact time, and the companies do the best they can with what they've got, and it's the system that needs to change.
I guess many old people looking in would look at Rochelle and think she's an absolute treasure. Can you tell us that she won't suffer for having come out and said what she said?
Well, I don't know Michelle personally, but...
well, she works for your company.
But what we need to do is just...
that's not what I asked. I said, can you say she will not suffer for saying what she said tonight?
Absolutely, I can say that.
Good.
We are as keen as everybody else to see improvement across the sector so that all patients get the great care they deserve.
Very briefly, would you say the government has to look at this and has to put more money in it?
Well, we need to make sure that money is channeled into it. But I think there is money in the system. We've got patients in hospitals who could be at home. We've got patients in nursing homes could be at home. The money needs to be channeled from those expensive provisions into allowing people to stay in their own home with the kind of care that people like Rochelle give every day.
Dr Richard Preece and Rochelle Monte up there in Newcastle, thank you very much indeed for talking with us.